Unfortunately, lies can come at us in three flavors: lies, damn lies, and statistics. So damn lies would really be willful deception. That's generally practiced by large entities that are exploiting us for profit. Let's take the most glaring example. Essentially, multicolored marshmallows being peddled to children as part of a complete breakfast. There's nothing on the front of that package that says, if you are a responsible parent, step away from the box and nobody will get hurt. That's what it ought to say. What the front of the box says is fortified with 11 essential vitamins and minerals, part of a complete breakfast. If you are a responsible parent, you will buy this and feed it to your child because they want it, and look how wonderful it is. Frankly, damn lies. Just damn lies. And then there are more innocent lies, experts who sort of topple into the vat of their own passions. So you're going to champion it in all probability, and maybe in the process get carried away and malign the work of others. Kind of a lie. Their work may be just as valid as yours. And then there's statistics, and there's almost an endless variety of ways to use statistics to distort and to use research methods to distort. One of the things that's really important is that although science is the most powerful means we've ever devised to answer hard questions, only sense can get us to ask good questions in the first place. Honest science is about not knowing the answer in advance, about being receptive to whatever story the data tell you.
What great messages to start with. I love that intro, and obviously, as you see, Dr. Katz will be on our show today in a few minutes. I want to just welcome everyone from really around the world. It's amazing to see how many people join the show from not only the United States, but other countries now. So we're really pleased to have everyone involved. I am Dr. Sal Akanina. I'm the medical director for the Lifestyle Medicine Institute and the CHIP program. So I want to welcome everyone again, and also remind you that these programs are recorded, so you can go back and watch them again on the CHIP website. And also that we have a chat box. So throughout the program, if you want to put your questions in the chat box, that would be great. So I will get on to introducing and telling you a little bit about Dr. Katz if you don't already know. And he's got an extensive background, so this will take me a moment or so. Dr. Katz earned his BA degree at Dartmouth University in 1984, Dartmouth College, his MD at Albert Einstein College of Medicine, 1988, his MPH, Master of Public Health at Yale University School of Public Health in 1993, and then he subsequently finished a residency training and board certification program in internal medicine in 1991 and preventive medicine and public health in 1993. Dr. Katz is the founder and former director of the Yale University's Yale Griffin Prevention Research Center from 1998 to 2019. He's the past president of the American College of Lifestyle Medicine, the president and founder of the nonprofit True Health Initiative, and the founder and CEO of Diet ID Incorporated, which we will actually be talking about today. I'm excited to talk to Dr. Katz about that. He's a fellow of the American College of Preventive Medicine, the American College of Physicians, the American College of Lifestyle Medicine, and the Morse College, Yale University. He's also the recipient of numerous awards for teaching, writings, and contributions to public health. He was nominated in 2019 for the James Beard Foundation Award in Health Journalism. He's been widely supported as a nominee for the position of the U.S. Surgeon General, which is an amazing award. And he's also received 3 honorary doctorates. He has an extensive media portfolio and has served as a nutrition columnist for the Oprah magazine. He's been an on-air contributor for ABC News and Good Morning America. He's had appearances on most major news programs, and he's been a contributor to major magazines and newspapers, including the New York Times and the Wall Street Journal. He is one of the original 150 influencers selected by LinkedIn, and he has a social media following of, get this, over 1 million people, which is incredible. He holds multiple patents. He has over 200 peer-reviewed publications. He's published many hundreds of online and newspaper columns. He's authored or co-authored 19 books, including his latest, well, I'll show you the one that probably most people have already seen, The Truth About Food, which we will be talking about today, and his new book called How to Eat, which is actually up on the screen right now. And he's been involved in multiple editions in leading textbooks in nutrition, preventive medicine, and epidemiology. I like this last statement. His career focus has been the translation of science into action for the addition of years to life and life to years. So let's think about that. I would like to ask Dr. Katz to join me on the screen.
Sal, thanks so much for the great intro. You know, I get the notices about these shows you do, and I keep thinking, wow, such great people get to talk to Sal. I hope he invites me some point. So I'm really honored and delighted to take my place in the parade of august guests here. So thank you.
Well, we are honored for sure. We have had so many great people, and thank you for being here. I'm really excited to talk to you about the truth about food, how to eat, and why don't we start out with about that one question? What do you think are the biggest lies about food? And you talked about them a little bit in the intro, but give us some more of your thoughts about that.
Well, you know, it's interesting. The book that I did after that, How to Eat with Mark Bittman, we were doing an interview together at NPR. And one of the few interviews we managed to do because the book came out just as the pandemic hit the world, and all our plans to promote the book fell apart. But I think at the end of that interview, they asked a closely related question. What do you think the public needs to know is the biggest news about diet? So you asked about lies, but they actually come together because the biggest news about diet is that there is no news about diet. And the biggest lie of all is that there's always news about diet. What you and I know, Sal, is that, you know, what's fundamentally important about diet for human health, for how we treat our fellow creatures, for the fate of the planet, is incontrovertibly established. Masses of incredibly consistent evidence from every kind of study in every population. You know, Michael Pollan put it in his famous 7 words: eat food, not too much, mostly plants. You know, that's been translated into whole food, plant-based, but, you know, minimally processed foods, mostly vegetables, fruits, whole grains, beans, lentils, nuts, and seeds, and plain water when you're thirsty. And, you know, everything else is basically just, variations on the theme. So the notion that there's always a new diet, a better diet, something to try, something shiny, something in fashion, that in many ways, that's the biggest lie of all. Now, I think there are many actors complicit in that lie. I think, frankly, maintaining perpetual pseudo-confusion about diet serves the interests of big publishers who want the next, fad diet bestseller, big marketing, big food, which, essentially finds cover there. Okay, so people are fixated on what nutrient this month? We just need a suite of junk food that's free of that nutrient. You want gluten-free junk food? We can make that. Lectin-free junk food, that's next on our list. Whatever it is, low-carb junk food, sure. Low-fat junk food, we got that. So big food's in on it. Big pharma, I think, is in on it because, you and I are passionate advocates for lifestyle as medicine, but business as usual in America is, run on Dunkin', have your multicolored marshmallows as part of a complete breakfast. And when you develop, as you inevitably will, disease like, coronary disease, type 2 diabetes that you never needed to get, big pharma will sell you the drugs to treat all that stuff. So, so the biggest lie is that we need news about diet, every 20 minutes. And again, I often reference the blue zones. Our friend Dan Buettner talks about 5 populations around the world that most routinely live to be 100, don't get chronic disease because lifestyle is their medicine. And they're quite diverse in their dietary practices, but it's all real food, mostly plants. And nobody in a traditional blue zone, is waiting for the Today Show to know how they ought to eat. They eat the way their great-grandparents ate. That's the formula. So that's the biggest lie of all. Right.
And I actually do tell my patients exactly that. If we listened to our grandparents when they said, eat your vegetables, go outside and run around, get enough sleep, we wouldn't be in this mess that we are today, which is so true. So, Your book is fabulous. I love the book. It's been great to read it and reference back to it. The truth about foods, as you just alluded to, is it's simple, but how do individuals really use the information that is constantly coming out about lies and truth about food in their daily life? How do you recommend that they do that?
Yeah, well, I think it is important to begin with the recognition that the truth about food is simple, but the lies are complicated. So the lies would have you believe that every new study that comes along changes everything. Stop the presses. There's a new study that says diet A beat diet B. Throw out everything you knew up until yesterday morning and start fresh. And then next week, diet B will beat diet A, and you do it again and you do it again. So, again, that cycle is put together to feed the interests of the news media, to titillate, to provocate. It is not put together to feed the knowledge, understanding, and practices of a population that wants to achieve good health. So, you've got to fight back. I often tell people, and for 30 years I told my patients, there's stuff that matters to responsible adults, stuff like your job, stuff like your family, stuff like a mortgage in your house and, wherever you live. And, you don't get talked into squirrely nonsense about those things. Someone doesn't come along and say, hey, there's an alternative to educating your children. It's much better. Only I know about it. Nobody else will tell you. Come here, let me sell it to you. Responsible adults just say, are you kidding me? And they walk away. When it comes to diet, you can feed people almost any kind of nonsense. And I sort of came up with an aphorism of my own. We know that familiarity breeds contempt. I think desperation breeds gullibility.
Yes.
The simple fact is, where people are consistently vital, lean, and healthy, it's not because they have, more personal responsibility or willpower than we do. They live in a place that makes it easier to be that, where it's the cultural norm. The blue zones, again, they're not renowned for, people with extraordinary willpower. They're renowned for cultures where eating well is the norm. It's the default. Where being active every day is the norm and the default. Where social connections, enough sleep, not having too much stress, avoiding toxins like tobacco are all normal. That's really what works. If you live in a place where it's all on you, your culture, runs on Duncan and makes it almost impossibly hard for you to eat well, but do it anyway, most people fail. And so to move in the direction toward liberation from all of that, you really need to treat health a little bit more like most people treat wealth. And let me develop that quickly. When we think about wealth, we think about working hard. It's not going to just fall out of the sky into our laps. Well, health is something that you also want to invest in. We think about investing. We think about saving. When it comes to wealth, hey, I made some money. I could just spend it all today. Wouldn't that feel great? But we don't, responsible people don't do that. I'll spend some of it today and maybe have a little fun, but, I'm going to put some away. I'm going to take care of the people that I love. I want to pay it forward. I certainly want to bequeath it to my children. Well, substitute health for wealth in all of those formulations. I'm a loving father and a loving husband. If I can share health with my beloved wife, I sure want to do that. If I can bequeath it to my children, I sure want to do that. If I can add years to their lives and life to their years, I certainly want to do that. If I need to work reasonably hard at this over the course of my life because there's so much value in it, okay, I'm good with that. It's worth it. I make an investment in health and I get a big return, and I get a big return I can share with my whole family. It's part of my legacy. Sign me up for all of that. And on it goes. So I think the one word answer to really get the party started, how do you start to translate these fundamental truths about diet, lifestyle into your routine, is to respect them. And I'm probably preaching to the choir, right? The folks that check into the Dr. Sal show are probably already completely converted to the value proposition of lifestyle as medicine. So those of you who are here listening in, tell somebody else, because the rest of the world doesn't know. And they need to. So we need to respect health at least as much as we respect wealth, and in all the same ways. grow it, work on it, incubate it, cultivate it, invest in it, and derive the greatest of all possible returns, and pay it forward to the people that you love. And I think, the seriousness with which responsible adults approach considerations of money and wealth also fixes a lot of the problem with diet. You don't listen to every rogue theorist that comes along. You don't suddenly take all your money that was sitting in pot A and put it in, pot Q because, somebody came along with a whole new theory about how you ought to do it. Most people don't do that.
Right.
So, I think just having a fundamental respect for the vast amount of evidence about diet, nutrition, lifestyle, health, for the stability of the weight of evidence, it really has not changed in decades. We keep improving it incrementally, but the fundamental elements of a health promoting diet have really been clear and consistent. They're consistent in dietary guidelines all around the world. And it's where science, sense, which gets too little respect also, and the global consensus of experts all are confluent. Now, as you know, Sal, the True Health Initiative, we have 500 or so world-leading experts in various health and medical disciplines from 46 countries. And their personal dietary practices are all over the map. Some are paleo, some are vegan, some are in between. But they're all willing to say, we agree on the fundamentals. The world will be massively better off if most people eat diets made up mostly of whole or minimally processed plant foods, namely vegetables, fruits, whole grains, beans, lentils, nuts, and seeds. They're all willing to stand up and be counted. So, again, latch on to a reliable truth and respect it. And then you build from there. The practices become issues of skill power. Do you know how to shop? Do you know how to cook? Time management, so you can fit it into your daily routine. And a lot of that needs to be personalized because each of us runs into a slightly different obstacle course every day. But it's doable. Just like you make time for your career. It's probably inconvenient, right? There's stuff we all manage to do no matter how damn inconvenient it is because it's really important. I would say health belongs on that list.
Absolutely. You always know what's important to people by how they spend their time and their money. When you really think about it in that regard, it really is true. So people can say certain things, but, you brought up a number of points and a number of thoughts for me. Teaching our children how to live healthy is something that all of us as parents should be doing consistently, and certainly teaching our families, if we can, and the people around us, in addition to our patients. And so often when we talk to our patients about taking care of themselves, oh boy, if I'm going to take a half an hour out of my day, I feel guilty about that because I'm not spending time with my husband or my kids or whatever. Self-care should never be felt as a guilty pleasure. It's something that's absolutely necessary for all of us to do. And, the video Make Health Last, I actually show this. I have a big screen television in my exam room, and I'll put it up there when people are really not sure about what they're doing with their health. And the way you aligned health and wealth. For most people in this country, they spend the last 10 or 15 years of their lives in sickness, not in wellness. And the video Make Health Last really is a great dichotomy. Same guy up on a split screen. In one scenario, he's aging in the standard American way. In the other side, he's aging in a vital way and really enjoying life. And that's really what we have to put in our brains. So your messages are very clear.
Sal, I completely agree. But one thing to add, because, you can feel, all right, Dr. Sal's a really smart guy. I agree with him. But still, it's just too much stuff to fit into my day. I like double dipping.
Yeah.
And what I mean is, I'm often asked about, mindfulness or stress relief. And I always give the same answer. I've tried many times over the years to meditate. And, I've confessed it to Deepak. I'm just bad at it. I'd like to be good at it. Maybe someday I'll be good. So far, I'm terrible at it. What I do when I'm trying to meditate is, how many emails could I be answering now? How many emails? I'm terrible. But physical activity, and in particular physical activity outdoors, fantastic stress relief for me. So which is it? Am I exercising or am I doing stress relief? Well, both. And I think the same is true also, with paying it forward. A lot of the time that we might like to spend with family, spend it on a walk, spend it on a hike, spend it, find these active things to do together. And you double dip, and it's much more efficient. It's also more fun. everybody wins. So, it isn't a laundry list where, okay, I tick off the physical activity and I tick off the stress reduction. No, I mean, it's, essentially each of us is the boss of our own lives. And we should feel completely authorized to take this menu of choices and create a recipe that's just ideal for us. And, how do I put this together? So, for me, hiking in the woods with my dog, or if I could talk any of my family members into joining me, it's exercise, it's stress relief. When I've got company, it's social connection. I mean, that's 3 out of the 6 pillars of lifestyle medicine right there, right? So, it's not as hard as it seems to weave these things together into something that you can wear every day and it really feels good.
Yeah, absolutely. And I like the term that you use, double dipping. I do that with my exercises. It's always good to put compound exercises together. Instead of just exercising one muscle, you can do different things. So I like the idea of double dipping your lifestyle. So I'm going to keep that in mind for sure. So we started talking about the science. The science becomes the truth if it's good science. And a lot of the science that we read is obviously really made for clinicians or for healthcare providers. But how does the common person take science and put that into action for themselves?
Well, first of all, again, I would say, the one word answer is respect it. It's interesting to me, fascinating really, that there's as much dialogue as there is in pop culture about the need to respect science. And the information about that, the arguments, if you will, are being shared by, guess how? Organized electrons beamed through cyberspace. I mean, how are we even connecting that? How many people on this webinar have any concept of how this actually works? I don't. It's magic.
Right.
It's magic. Sal and I are having a conversation. We're not in the same place. You're listening in. You're in a different place altogether. It'll be recorded. It can be transmitted anywhere.
It's true.
There's a unique URL you'll be able to use to get to this. And then the stuff we do every day with our cell phones. Send a text message. I can basically, from my mind to my fingers to something I'm holding in my hand, and almost instantaneously, my friend in Australia, will get a ping, and just to that one phone and it's magic and it's science. So the science of engineering, I think, puts on vivid display and in our pockets and in our handbags every day. The simple fact that science works. So respect it, but everything can be weaponized. And so, one of the hallmarks, I think, of the most responsible scientist is uncertainty. Science is incremental. We never know anything with absolute certainty. So, when you're listening to someone who's honest about science, you might hear, I'm extremely confident that. So, for example, I talk about the fundamental truths about diet and lifestyle and health, masses of consistent evidence. But even when I say fundamental truths of what we know, it's not necessarily a fact that can never be explored and fleshed out. So, do we know whether, kale is better than spinach or vice versa? Some of these questions are such a fine level of parsing. You could say, well, who cares? But actually, that populates a lot of the nutrition literature. We get these debates. This is better than this. No, this is better than this. And sometimes sense would tell you it's just an unimportant question. So respect science in general. Make sure the question actually matters. I would say in general, move away quickly when you're hearing absolute certainty. I'm right. I know the truth. Nobody else does. Science doesn't work that way. We all stand on one another's shoulders to try and reach greater heights. It's a community effort. It's an incremental process. It's evolutionary, hardly ever revolutionary. So, look for incremental change. There isn't going to be one study, not today, not next week, and probably not ever, that fundamentally changes everything we thought we knew about a whole discipline overnight. There's the occasional epiphany, a bbig leap forward. Even then, it's directionally aligned with the bulk of work that came before. Certainly in nutrition, here's something to keep in mind. As you know, I've ran a clinical research lab for over 20 years. I've made my living doing science. But a quick reality check here, folks. Every wild species on the planet knows what it ought to eat, and none of them do randomized controlled trials except us. And we're the only species that's completely befuddled about what we eat.
Right.
I mean, there is a native context. There is adaptation. There's sort of a simple bedrock underneath our understanding of diet and lifestyle and their association with health that were here before science was ever even invented. So science really ought to serve to populate the gaps in what is already readily apparent, right? We don't need randomized controlled trials to know that wildebeest ought to eat grass and lions ought to eat wildebeest. I mean, it's just pretty obviously on display.
Right.
So, the basic care and feeding of Homo sapiens is not nearly as great a mystery as pop culture makes it out to be. The one other thing, and I've done a fair amount of work in this area, Sal, including a project for the American College of Lifestyle Medicine. We called it HELM, Hierarchies of Evidence Applied to Lifestyle Medicine. Mm-hmm. The idea that the way we judge science has to be relevant to the questions we're asking. Right. So, let's say I want to know the dietary pattern that will lead to the longest, most vital life. Mm-hmm. Can I answer that with a randomized controlled trial? Well, no, I just said, my outcome measure is a long, vital life. So I want to see people live without chronic disease to 80, 90, or 100. And if I want to determine what diet does that, I have to randomize them at birth or before to diet A, B, C, or D, and then follow them for 100 years. Right. Has that trial been done? No. Do you expect it to be done? It ain't going to be done anytime soon, right? So RCTs can't answer every question. Right. And you already know that. And a lot of what we know comes from sense. I pointed out to all of my fellow parents, you've never read a randomized controlled trial telling you to tell your children not to run with scissors, but you don't really need to wait for one, do you? Right?
Exactly.
So respect science, use science, respect the incremental progress of science, respect the fact that it's a community effort. No one person has a monopoly on the truth. If they tell you that, run away. No one person knows the stuff that none of the rest of us are willing to tell you. If they tell you that, they're trying to sell something, run away. Mm-hmm. And, kind of embrace, you're asking me, Sal, about using it. Again, use what is fundamentally true and clear and well established, rather than saying, hey, I'm going to wait till we know every last thing about diet. So, I keep hearing debate, about this kind of bean or whether, eggs are okay or not okay. And until they resolve that, I'll be at McDonald's. No, don't do that. Use what we know for sure. We'll continue to fill the gaps over time, but we know enough to eliminate 80% of all chronic disease and premature death. Right. Really, just use what we know reliably that has stood the test of time. 80% of all heart disease, cancer, stroke, diabetes, dementia, and premature death from all causes could go away. That's the value proposition of using diet and lifestyle as medicine.
Yeah. I think we finished our training at around the same time. I think you're more adept at the science than I am. So in my practice, I really rely on 27, 28 years of anecdotal evidence to see what happens to people when they do this, or what happens to do with people when they do that. And that's what I tell people. Look at individuals that live the standard American lifestyle versus people that don't, and what happens to them.
It's interesting. So I've published many RCTs and meta-analyses and systematic reviews and all these. So, I'm very much a card-carrying member of the Evidence-Based Medicine Club. I've written textbooks on evidence-based medicine. Right. And yet I completely agree with you. We disparage the humble anecdote, except, I've said to my patients over the years as well, if you look at this from altitude, you call it an anecdote and say why it's unimportant. But here's the thing, between you and me, what actually happens to you is what actually happens to you. It's more important than anything. I mean, if an RCT says, no, that shouldn't have happened, who cares?
But it did happen.
It did happen, right.
Exactly.
I completely agree. And it's part of the evidence base too. And I agree with you. I mean, you kind of look at the incredible divide between people who adopt these basic principles of using lifestyle as medicine and people who don't. And the difference is vast. We were talking before the camera started rolling here, that puzzle on the wall behind you. You were saying you're a 92-year-old, or she just turned 93-year-old mother. Just recently made that puzzle and put it together. And I don't know if she climbed the ladder and hung it on your wall. No. But, it's the kind of thing we see all the time. I was just skiing with my dad in his backyard. He's got a nice hill. It was snowy. We were skiing. But my dad's 81. We weren't just skiing down. We were hiking back up in ski boots, carrying our skis. My 81-year-old dad was right there with me. I was thinking, okay, I've got to look like this isn't too hard, because it's going to be embarrassing. But that's the value proposition of embracing this. And it's not us. It's not Dr. Sal or me or anyone else, wagging a finger.
Right.
It's healthy people have more fun. Other things
yeah.
being equal, you do get more years in life, more life in years, more vitality to do the things you like to do, or at least before the pandemic, you could have done things you like to do.
Exactly.
And we're hoping we'll be able to do those things again before too long.
Oh, we will. I have it on my bucket list to visit as many of the blue zones as I possibly can before I leave the planet.
That's a good one.
I want to get to some information about your diet ID. I've talked to the people at Spectrum Health, where Dr. Arts and a number of the individuals over there have been using the CHIP program, but they've told me about Diet ID and how helpful it's been. And we've talked about this previously. We have certain vital signs that we use in the exam room, checking blood pressure and height and weight, so on and so forth. And when we really talk about the concept of using nutrition and diet as a vital sign. So give the audience, please, some information about Diet ID, because I know they really need to hear this piece.
Thank you very much, Sal. Well, it's my passion, and I left academic medicine after 30 years to found and run Diet ID as a company, because I think the innovation is that important. Just a quick bit of background, and you captured it very nicely. I have recognized for a long time that if we're going to manage diet more routinely, help people manage their own diets, we have to measure it. There's an expression from the world of business: we only manage what we measure.
Right.
So Diet ID is to diet what a blood pressure cuff is to blood pressure. And there was an op-ed in the New York Times, August 26th of 2019, for those who want to Google this. "Our food is killing too many of us." That was the title. Mm-hmm. Our food is killing too many of us. And the authors were Dariush Mozaffarian, colleague, Dean of Nutrition at Tufts, and Dan Glickman, former Secretary of Agriculture of the United States. And in this op-ed, they make the case and cite the primary literature, saying that, and this was before the pandemic. So, we crossed the terrible threshold where COVID had killed over 500,000 Americans. And I lament that. But diet kills 500,000 Americans or more every year. And it hides in plain sight. So bad diet quality is responsible for over 500,000 premature deaths in the United States every year. So that's what they wrote about. And then they started talking about the remedy. How do we fix this? And the first thing they said was, well, then, diet, nutrition should be in every electronic health record. It's a critical indicator of your health status. Poor diet quality means bad stuff's going to happen. And then very recently, just a few months ago, the American College of Cardiology came out with a formal position statement. Diet is so important to health outcomes. It needs to be captured in every clinical encounter. And we need tools that can do that. Well, Diet ID is the tool that can do that. And in terms of how it works, you can learn much more about this by going to dietid.com. And if I know Daryl behind the scenes, he's probably pulled that up and it's on the screen. But here's how it works. I'm wearing glasses. Sal, you're wearing glasses. So at least the two of us, if not any of you, have been to an eye doctor. And when they're trying to figure out, what do you need to see clearly in your dotage, you do the phoropter test. You look through these lenses, you see two images, balloons or something, and they say, which one's in focus, A or B? And you say B, and then they show you two more and say, how about now? And you say A, and they say, here, two more, how about now? You probably all know the game. Yeah. You play that game for 30 seconds, 60 seconds at most, and there's an exact match for your eyes in diopters, and you get your prescription and you can see clearly. And you didn't need to struggle to remember, how do you think you see at twilight, and how do you think you see when you're tired, and how do you think you see on Wednesdays versus Fridays? And imagine the 50-page questionnaire asking you to try to remember how you see under all these different circumstances. They don't do that. With diet, that's what we've tortured people with. How many times over the past 6 months have you had pasta? And by the way, what kind of pasta? And by the way, what were your serving sizes? And by the way, what was your sauce? And by the way, how much of that? And nobody can remember that. Diet ID took this method, the phoropter method, and applied it to diet. So we mapped all of the real world diets for the United States, for example, turned them into images. And when we ask you just a couple of questions so we know which part of our diet map to show you, we show you two images right next to another on your computer screen, on your smartphone screen, and ask you which of these looks more like stuff you routinely eat. A or B. You say B. We say, how about now? You say A. Same exact game. Within 60 seconds, we can provide a comprehensive assessment of your diet type, your diet quality measured using the Healthy Eating Index 2015, which is the most robustly validated measure of diet quality. We can report servings of all the different kinds of foods. We can report out nutrient intake levels. And we can use that same platform to help you identify the optimal diet for you. And then if we know your starting point and we know where you want to go, we can draw the line. And it's not a generic, here's how to improve your diet, one size fits all journey. It's your personalized journey. It's here's where you're starting. Here's where you want to go. Here's the route. And then we can populate that with a sequence of micro challenges delivered digitally to help you get there from here. And it's a unique trip for you. You can work with the community. We've got social engagement, all the usual behavioral supports built into what we call behavioral navigation. But it's really like a GPS turn list, except it's applied to improving your diet, and it's your personal journey. And I like the idea of behavioral navigation. When you talk about behavioral modification, it sounds like you're a little bit broken, but don't worry, we're here to fix you. When you say behavioral navigation, it sounds more like it should. Hey, you're the boss. You know what your goals are. You know what your objectives are. You know how you want to eat and how you want to feel. Once you sort that out, and we're happy to help, but it's your decision, we'll help you get where you decided you want to go. So we call what we do behavioral navigation. So that's it. So it's the first fundamental advance, Al, in how to assess diet. Believe it or not, in our lifetimes. I mean, there really has been no major advance since the introduction of the semi-quantitative food frequency questionnaire decades ago. So we think it's a big deal, and we're on a mission to make diet the vital sign it deserves to be.
Right, exactly. That's wonderful. We really need to use these tools, and although we certainly do speak to the choir, I think most of the people that join the show really are in the choir. We can really distribute this information to people that are not in the choir and really make a big difference.
We need the choir to sing. So those of you who are here afterwards, sing out.
Start singing, exactly.
I agree. I mean, that's how it is. Inevitably, you preach the gospel of health promotion, and you get people who are highly motivated to tune in. But if each of us is always doing what we can to pay it forward, it reverberates out, and within 6 degrees of separation, we'll be converting Kevin Bacon.
Exactly. There you go. So we only have a few minutes left. How would you summarize what you think the audience can do as an action plan starting today that will really help them make a significant change in their own lives and the lives of the people around them?
When I think about the value of medicine, I really do have a great respect for all aspects of it. I've been an internist my whole career, and I've prescribed drugs. And listen, when you need an antibiotic, carrot is not going to do the job, right?
All right.
But if you want to think about, what is the one area where I have the greatest potential to maximize my own vitality and consequently fun, because healthy people really do have more fun. Do something that I can share with the people I love, pay it forward. And, if I share with them, I'm really doing a service, but also by sharing it with them, they make me better at it, because in unity there is strength. And by the way, I kind of am partial to planet Earth, and I'd like to do what I can to help make what we do here sustainable over time. And I kind of like lions and tigers and bears, and would like future generations to have a planet, that has biodiversity. You care about all of that. Eating a plant predominant diet absolutely tops the list. I mean, it's just check, 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 check. So if you're already there, great. If you're there but wondering, is it really worth it? Yeah, it's really worth it. If you're wondering, should I promote this to other people? Hell yeah. Because again, it's the one thing we can do. It's actionable at the level of an individual. It directly impacts our carbon footprint. It has implications for the climate. I mean, it matters in every way imaginable. And the rest of the formula of lifestyle medicine, it really is stuff that is under individual control. Doing what you can to fit physical activity into your daily routine, and there's no one right way to do it. And I've had people over the years tell me, Sal, your patients have probably told you the same. I'm too busy to make time for these things. And my answer has always been, oh, that's interesting. I'm too busy not to, because I can't maintain the pace of my activity unless I take good care of myself and stay vital. So to me, this is time well invested, because I get more out of every day, and I'll get more days out of my life of productivity if I do this. So make it a priority. Do it with the people that you love. And then, make sleep a priority too. Take stock of the stress in your life. I don't think you have to, I have to add meditation to healthy cooking to go. No, maybe,
Yeah, sure.
maybe you can combine these things, like Sal and I do, right? So for me, exercise, stress relief, it's all one thing.
I can't meditate.
Yeah, I really, my wife keeps telling, come on, you can do it. Maybe, but not yet. So again, and there should be no, oh, woe is me here.
Right.
The one other thing I'll toss into the mix out, Catherine, my wife, and I, have long espoused the view, you can love food that loves you back.
Mm-hmm.
I think about eating well as a great pleasure, and essentially maximizing pleasure, because you get pleasure out of good food and you get pleasure out of good health. And you could think about, well, I want to add those two together and get the greatest possible sum. Right. So, you work toward sort of, if your taste buds have been corrupted by the typical American, right, you can take them through taste bud rehab, and step by step,
right, exactly.
You can love food that loves you back. And physical activity, again, there's no woe is me. We have a native animal vitality. Modern culture has encouraged us to cage and put on a leash, and it, it gets used to that, and it gives in. But you'll be amazed, as you start to let it off the leash and out of its cage, how rewarding it really is. And think about, if your mom's active at 92 and my dad, all the things we can do together at 81, what a gift and a pleasure that is. So there's no, oh, woe is me factor here. It really, using lifestyle as medicine, good for our fellow creatures, good for the planet. And in terms of our own joie de vivre, it really is the gift that keeps on giving.
Right. I love that. And I love that statement, love food that loves you back. So we're going to leave people with that last statement. I really appreciate your time. We could talk for hours more. And I love these shows. Last week we had Dr. Hans Deal on, and he's been on the show several times already. We've just had some great people on the show, and I am really honored that you took time out of your busy schedule to be with us. Even more so, I have to thank you, like I thank so many other people that have been on the program. We stand on the shoulders of so many people that for years and years, for decades, and really have devoted their lives to helping other people live a healthy life, to really changing the planet in the ways that you described so far. So a big heartfelt thanks to you for being on the program and for everything that you've dedicated your life to the people that are listening to the program, and hopefully they'll come back after next week when we have a new and revived show. And look forward to next week when we have Pam Popper on the show. So, David, it's a pleasure to see you as always. I have to also thank Daryl, our guy behind the scenes that does a great job for us. And I wish you a great start of the new year, and blessings to you and your family.
Thank you so much, Sal. All the same back to you. Been a great pleasure. Honor to join you. And I look forward to a time when we can actually be in the same place again sometime soon.
Sounds great. Stay well, David. Good seeing you.
Me too.
Thanks. Bye.